Role play number 4, Cantonate cue card. Setting is a hospital ward. Nurse, you are speaking to a 45-year-old woman who has been admitted to the hospital with a suspected stroke. Okay, you have been asked by the doctor to administer a Warfarin injection, that is an anticoagulant, to the patient. So task 1, take a medical history of a patient before giving the injection. Task number 2, explain that after the injection, Warfarin need to be taken in tablet form every day for the next 4 weeks. Task number 3, explain that you need to check with the doctor if she can continue her herbal supplement. It may interfere with Warfarin or cause side effects. Task number 4, emphasize the importance of cautionary measures regarding Warfarin. Minimize vitamin K in diet, avoid OTC medicines due to their interaction with Warfarin. Take a dose at the same time each day. Task number 5, offer to provide a detailed patient information leaflet on Warfarin. Task number 6, advise the patient to stop the medication and contact the doctor immediately in case of unusual or prolonged bleeding. So directly we can move to the role play. So first, nurse, hello, my name is Lena and I am one of the registered nurses on ward duty today. How may I address you? Patient, hello nurse, call me Natalia. Nurse, Natalia, I'm here to give you your medication. Is that okay? Patient, yes, that's all right. Nurse, thank you. The doctor has prescribed Warfarin. It is an anticoagulant medication used for thinning the blood. Have you heard of this medication before? Patient, yes. I think they are the tablet that my father takes for his heart condition. Nurse, yes. Warfarin is usually taken in tablet form, but in your case, the doctor has advised an injection to get it working more quickly. Patient, oh, all right. Nurse, before I can give you the injection, I need to ask you a few questions about your condition. Is that right? Patient, okay, go ahead. Nurse, do you have any ongoing medical condition like hypertension or diabetes? Patient, yes, I have a polycystic ovary syndrome. Nurse, okay, do you take any medication for it? Patient, yes, I take a herbal supplement which helps to calm down its symptoms. Nurse, okay, are you on any other medication at the moment? Patient, no, I'm not taking anything else. Nurse, are you allergic to any medication? Patient, not as far as I know. Nurse, okay, can I ask if you drink alcohol? Patient, no. Nurse, all right, and would you mind telling me if you smoke? Patient, no, I have never smoked in my life. Nurse, so to go over what you said, you are not on any medication at the moment, you are not allergic to anything, you do not smoke or drink alcohol, and you are taking a herbal supplement for polycystic ovary syndrome. Is that correct? Patient, yes, that's right. Nurse, all right, I am going to give you the injection now, following which you will need to start taking it in tablet form on everyday basis for the next 4 weeks. Patient, okay, for a whole month did you say? Nurse, yes, that's correct, as I need to check with the doctor whether you can continue taking your herbal supplement. Patient, what? Why? It really helps me in calming down my symptoms. I do not think it's dangerous in any way. Nurse: well, warfarin can cause problem if it's taken with some herbal supplement. Therefore, I need to check with the doctor once and you can take it if he approves. Patient: what kind of problems? Nurse: I can sense that you are concerned regarding giving up the supplement. Allow me to explain why I said that. Some supplements interfere with the medication efficacy or may cause side effects, so it is imperative that we take the doctor's consent in this matter. Patient: oh, alright. Well, I think I'll avoid it at the moment just to be on the safe side. Is there anything else that I might interfere with this medicine and need to be avoided? Nurse: yes, you are something you need to be mindful of. Firstly, you need to take your medicine at the same time each day. Do you think you will be able to do that? Patient: yes, it's not a problem. I will manage. Nurse: good. Secondly, do not take any over the counter medication without checking with the doctor first. Like I mentioned earlier, there may be potential implication of adding new drug to this medication. Patient: sure, I understand. Nurse: finally, you will need to minimize your intake of foods rich in vitamin K as they can make the warfarin less effective. Do you have any questions so far? Patient: yes, except I'm not sure I know which foods are rich in vitamin K. How do I know what to avoid? Nurse: yes, I understand what you are saying. I can give you a patient information leaflet with the detailed information about managing your diet while you are on warfarin. Alright, that sounds good. Nurse: do you have any concerns about what we just discussed? Patient: yes, I'm worried about taking warfarin. Sometimes these tablets give me that nosebleeds. Nurse: right, I can understand why you have this concern. I will explain why your dad gets nosebleed with warfarin. Nosebleeds can be a side effect of warfarin. That being said, let me reassure you that these happen only occasionally, and warfarin is generally well tolerated by patients. It is not something to be concerned about. However, in case the bleeding is excessive or prolonged, you must contact the doctor immediately. Patient: oh, you mean it can cause a hemorrhage? Nurse: I can understand it's frightening, but it is not a common occurrence. Still, as a precautionary measure, I want to advise that you should seek immediate medical advice in case the bleeding is unusual. Also, in such a situation, stop taking the medication until the doctor advises you to resume it. Warfarin is not dangerous if you adhere to the instructions outlined in a patient information leaflet. And in case you notice a symptom that you feel is a cause for your concern, get attention immediately. Patient: okay. In case I notice heavy bleeding, I should stop the medication, right? Nurse: yes. In the case of severe bleeding, the doctor might regulate the dose. So it will be best to check with the doctor for resuming the medication in that case. Patient: okay. Nurse: is there anything else that you would like to ask? Patient: no, I guess I will read the leaflet and let you know if I have some more questions. Nurse: yes, that's good idea. I hope I was able to address your concern. Patient: yes, the conversation helped. Nurse: thank you. I will just get the patient information leaflet for you and you can press the buzzer in case you need anything else. Patient. Okay, thank you. With this, the role play ends.